thank you all for joining us on this seminar in relation to the Clinical Innovation Award. And today I am really happy to be speaking with Dr. Eimear Dolan in NUI Galway. Hi Eimear, thanks for joining me.
Hi Steve, thanks so much for having me.
No, not at all, our pleasure. Would you mind introducing yourself and just, I suppose, telling us about yourself and then maybe kind of your involvement or your interest in medical device and healthcare technology?
Yeah, of course. My name is Dr. Eimear Dolan, as Steve said. I'm a lecturer or assistant professor in Biomedical Engineering in NUI Galway, and my research is mostly focused on developing mostly implantable medical devices, but I have an interest in designing new and innovative and cool medical devices. I also teach a module to our third years on the design of medical devices, and I'm involved in the Bioinnovate program here in Galway. So a lot of what I do is really focused on developing and designing medical devices.
And I like the way you say you're interested in cool medical devices. So I mean, you're not specific in the area. You're willing to look at all areas as long as it has some sort of medical device edge to it.
Yeah, just not the boring ones.
So high tech, high impact, cool medical devices. That's good.
Exactly.
But
no, I think it's medical. I think medical devices is really interesting because I would have worked in a lot of different areas. My PhD was in orthopedics. I did a postdoc then in cardiovascular, then I worked in diabetes, then back to cardiovascular, and now I've kind of projects going in probably all of those areas in addition to ovarian cancer as well. So I think it's really, you can learn an awful lot from one application that can be applied directly to another one. And what devices and what techniques are used for one may not have crossed over to another application, but you can take inspiration and learnings from across the board. So yeah, definitely open to different applications.
And I think there's kind of a sub point there as well, is that even in medicine or in health or any kind of industry really, there areas can be siloed. So there could be massive developments in one area that has huge crossover potential, but just because they're so siloed, they don't talk, or they mightn't talk or have any interest in meeting or opportunities to meet, that they're missing opportunities, I guess. Is that?
Yeah, absolutely, definitely.
Yeah, so you have a fairly diverse background, particularly in the medical device space, which is really important to get that kind of perspective. So we're having this conversation around the Clinical Innovation Award, so there will be clinical people and probably other researchers looking at this and wondering how they get involved. The Clinical Innovation Award wants applications from clinical leads, but they can collaborate absolutely, and it's encouraged with universities and with IoTs and technical universities, with the staff therein and the academics with the expertise. You've gone down this path yourself a few times. Would you give us some examples of projects that you've been involved with, and I suppose from a person who doesn't really know anything about it, the process and what makes it a successful project?
Yeah, I think probably every project, most projects anyway that I've worked on, have always had some level of collaboration either between industries. So my PhD was with Stryker Instruments, who are based in Cork, and then in postdocs and the projects I've worked on since have all or most of them have had either collaboration with industry or collaboration with clinicians or both. And I think that is so important because you get a different insight into what is actually important or what's not. So, when the engineers are thinking about things, we're kind of designing solutions to problems. But like, for example, working with clinicians, they can very quickly say, no, that's not going to work. We're not going to do that. So it kind of, the really close interaction or communication with, say, clinicians, for example, really helps you stay on track the whole way through. So, you know, we're not in the clinic, we won't be using these devices, but we're trying to think of ways to solve a specific problem. So I think when you have that really close interaction and close relationship with clinicians or patients or industry, like all the different perspectives are so important. And yeah, patients is another one that I think is really, really important. And I know we're doing more of that now. But again, like getting their input and perspective early is so important. And it kind of helps us as engineers to narrow down and focus in on, you know, our design inputs even. It's, okay, this is the patient said they want it this way, clinicians said they want it this way, and that helps us kind of focus and kind of achieve your goals quicker, as opposed to kind of going down a path that is never going to be used.
Yeah, no, that's it's brilliant. It's kind of answers the question, will they use it? So when you can engage with a clinician or somebody who understands the problem or the space, and they're dealing with it kind of every day or regularly, and you're coming in from a technical perspective as an engineer or a designer or whatever, that you can actually talk to the people who you're building it for, whether it's the clinician or the patient.
Yeah, and like there's you know, we can read publications and books and whatever online, but like you don't get that perspective. You need to be talking to the clinicians and talking to the end users to get that information.
Yeah, and we see that in the Health Innovation Hub, and kind of like in a regular on a day-to-day when we're linking groups, entrepreneurs, innovators, or companies with clinicians. It's often really fundamental or rudimentary things that haven't been considered, you know, and like you said, it's the design inputs, and that can be anything from, oh, well, we don't have iPads on every ward, so we cannot use your software, or this will only work if you're left-handed, or you know, these sort of things are
yeah, or that's really important. Like, oh, of course, you know, we have to use this with one hand because my other hand is doing whatever, and you know, we don't know about that unless somebody tells us. So like that information is so important to us.
And in terms of, say, even beforehand, like the problems themselves, before you're working with somebody, in terms of what should you be building for, where, like, getting that inspiration or understanding those kind of needs, the value there in linking with clinicians. Can you give a few examples on that? Or
yeah, I think I mean there's loads of needs to be solved, right? And I think if I'm not sure if many of you guys are familiar with the BioInnovate process, but what happens in that program is loads of BioInnovate fellows go into hospitals and they identify loads and loads of needs. And sometimes they have hundreds of needs that needs to be solved. And then they go and kind of explore each of the needs and identify, you know, okay, why hasn't this been solved? Or is there a market there? Or is this just a problem on this ward in this hospital? Or is it this a problem in, you know, all the wards in all the hospitals? So I think asking those questions are so important to start, to be like, okay, you know, is this actually a problem, or is this you know, just something that I find annoying? And you know, if it is actually a problem, then is there a market? And those two things I think are the most important questions to ask. You know, what are the competitors doing? You know, are other people finding this to be a problem? Two really important questions. And I think if you've identified that and identified that you know, it is a problem, both in Ireland and, you know, in other markets like the US in particular, and you know, is there a market there? Will somebody pay for it? Then I think, you know, you start honing in on, okay, and then you start talking to somebody who like an engineer or whoever you need to help you solve the problem. And then I guess the next question is this solvable, or is this a really hard technical solution?
and I mean, that's a really good point in terms of, like, is there a market there? Is somebody willing to pay for this? Are they already paying to solve the problem somewhere else? And I mean, it's a question you ask, like, you know, when you're engaging with a project, you know, like, is it something that's just bothering you, or is there a massive market there? Is this worth our while putting, because the same amount of time and energy in developing or applying for a grant for, you know, paper won't refuse ink. The other thing then was the BioInnovate program, which you're involved with, is probably one of the most successful kind of programs in terms of spinning out and developing medical device companies. And we will speak with a BioInnovate fellow or two as well as part of this series, just to hear their journeys. But again, it's like what you said, their model is based on identifying a real need before they commit to you know, the solution development. So it's you know, it takes a while to get into that mind frame.
Yeah, and it's hard to, well, I guess it depends on who's asking the question, but for me, I definitely find it hard not to jump to solutions. So, you know, straight away I'm like trying to think of a way to solve the problem, but you know, you kind of, and that's what the BioInnovate process actually teaches people to do, is, you know, don't think about the solution until much further down the road. You know, identify, you know, is there a problem, you know, is there a market, and is this a real need? So yeah, I think it's a really great program, and it's great that you're going to hear from some fellows.
Yeah, no, I'm excited to speak with them. I suppose the next question, and it's around, I suppose, a little bit of advice for people who you know, what should anyone thinking of engaging with an academic or a researcher like yourself to develop his or her project need to prepare in advance?
What should they prepare in advance?
Yeah, before they meet you, what should they have? How many of their ducks do they need in a row before they come talking to you? Or, you know, what's the kind of minimum threshold to some people probably sorry, some people probably think they might need a prototype before they come to you, which isn't the case. Sorry, go ahead, Eimear.
No, sorry, I could have crossed you there. I think no, I don't think you need a prototype. I think if you have a convincing argument that this is a problem and there's a market for it, so I guess if it's a problem, like, I think if it's a convincing argument for that there's a problem, I think you could convince a lot of engineers to get on board to try and fix it. But in order to get funding, you also need to convince the funders that there's a market there. So I think if you have a convincing argument for both of those things, and, you know, maybe some ideas of how to do it, but like, you definitely don't need to have a prototype, or, you know, you could say, okay, this is what I'm thinking. What do you think? And I think then, like, I think that would be what I would, that many ducks.
Yeah. So it's understand that there is, again, kind of reiterating it here, that there is a market, people are already paying to address the problem, and that you know, you can prove there is a problem from a clinical perspective as well, so that makes it attractive for people to solve.
And I think as well, actually, understanding what the researcher is actually doing, and so, you know, looking into, like, there's a lot of information about what all academics do a bit online. So I think if you're researching who you're contacting, I think that's so important. You know, if you want to talk to, you know, somebody who has an experience developing, I don't know, surgical tools or something, like, be familiar with what they've done so far, and, you know, have a convincing argument of why you're talking to them and why you need them on your project. I think you know, as I mentioned, I have a bit of a broad experience, but, you know, I definitely couldn't design everything, or, you know, I think making sure you're talking to the right person, and you have a reason why they're the right person to talk to, and why you think that their background and experience is relevant for your project.
And I mean, it's a really good point. You can Google pretty much everyone working in the public domain in Ireland for sure. Everyone's contactable, whether they answer you or not. That's a different story. But I mean, you can very easily see what areas you have worked in and publications that you've been involved in, and other projects that are ongoing. And that's kind of across the board for most active researchers or academics in research. So it's really, you know, it's not that challenging to find out who people are and what they do.
Yeah, and I think if you're trying to kind of convince somebody to get on board to write a grant with you, you know, you want to, you know, the academic or the engineer in this case, will be very much involved in like writing the grant. So you want to make sure that you're picking the right person, and you've done your homework on why you want them, like involved in the project. So an example recently is that like a clinician emailed me. I didn't know him, out of the blue, and he had an idea for a project, and he had looked at all of my previous publications, and we had a call, and he was like, oh, and you did this, and this is the reason why this is important to me, and then you did this other thing, and this is another reason why this is important to me. And was really convinced, you know, it was very clear he'd done his homework, he knew what he wanted, and he knew what of my skills he wanted to help solve a problem with him. So I think like that's, you know, it's very, you're signing up to join a team to solve a problem together. So, you know, both sides want to be convinced that they want to be part of the team.
Yeah, and like that's a fantastic point, because it is a team effort, and these projects in so much as we're involved, they're not small projects, they're not one-offs. The feasibility could, you know, it could be negative, and that's fine. It ends there without too much commitment. But if it is positive, the view here is it's a long-term commitment to bringing a piece of technology to market and to the bedside. So it's like what you said, the team is important. Do they have complementary skill sets, and can you work together?
Yeah, and it's not a case of somebody just handing over an idea and then the engineer designer taking it over and developing it from there. Like that's not what you're signing up for here. It's kind of more of a collaborative effort that you're working together through the whole process to make sure that you're making, you know, achieving your goals and developing something that will actually be used in the end.
Yeah, no, that's brilliant. Yeah, it's commitment. Are you committed? you have to do some legwork. So yeah, we're kind of coming up on time, Eimear. So I'll just say, I suppose, how should someone kind of, is it okay for people to engage with you? Just to reach out, having Googled you, of course, and make sure you're in the right space.
Yeah, of course. And, you know, like I think Steve has always been so helpful in linking people up, and the TTO in Galway has always been so good at linking, you know, projects to academic staff in the university. So, but yeah, I would just do some research into making sure you're getting the right person, and chat to them and chat to multiple people. Like I don't think, you know, emailing one person and having a chat with them, like you're not tied to it, you're not married to it. You might decide after a call, okay, no, that's not going to work. You know, I'm going to try somebody else, and that's fine too. I think the majority of people will, you know, be happy to take a call and discuss it, and then decide where to go from there.
And like that's exactly our role. And the role of the TTOs at the technology transfer offices. We spoke with Fionnuala Brown from the Innovation/Tech Transfer Office in Galway, and that was her advice as well. You know, just come into them early, and they can point you in the right direction. And that's, we too in Health Innovation Hub try to provide that kind of a matchmaking service. And you know, if it works great, and if it doesn't, you find out very quickly that it's, you know, it's just not compatible. Move on, find somebody else, and progress. It's, you know, you just testing the waters, really.
Yeah, and not everybody think your idea is good. I think that's the one thing that you need to bear in mind as well. But that doesn't mean that it's not a good idea. So, you know, if you talk to one person and they say no, that's never going to work. just talk to somebody else to make sure.
Well, this is something, and I will finish up on this then, that we kind of get, we hear it a lot when talking to people who have put one foot into the entrepreneurial or the innovation spaces, to give it a go, to back yourself, to find out, to fail and fail quickly, is better than holding on to an idea and never trying it, because you'll learn and you'll move on, and your next idea might be the next big thing.
Yeah, exactly.
Yeah. Eimear, thank you so much for your time. Really appreciate it. And we'll chat to you soon.
Sounds great. Thanks very much, Steve.